Hey guys, welcome back to our channel Prepare FMGPG. Let's start with another left question. They may ask you about labor stages. So you have to answer like there are 4 stages. In first stage, it starts from uterine contractions to complete cervical dilation, that is 10 centimeter. Second stage, from complete dilation of cervix to delivery of baby. Third stage is placenta expulsion, and fourth stage is 1 hour observation. Then ectopic pregnancy. What do you know about ectopic pregnancy? Pregnancy in which fetus develop outside the uterus, like ampulla, isthmus, interstitium. Most common site is ampulla and earliest site to is isthmus. We can diagnose it by transvaginal sonography. We will see ring of fire or Bugle sign. Drug of choice for ectopic pregnancy is methotrexate. They may ask you COVID in pregnancy. How do you deal if there is a COVID positive pregnant lady in your ward? Okay, then you must have to answer like COVID is absent in vagina, COVID is absent in amniotic fluid, COVID is absent in breast milk. So can you do vaginal delivery? Yes, I can do vaginal delivery because as it is absent in vagina. Okay, can you do induction of labor? Yes, I can do as it is absent in amniotic fluid. Okay, can we do artificial rupture? Yes. Can we do cesarean section? Yes. So you must have to know most common transmission is after baby birth, like in postpartum period. Most common route is by droplets. Hydroxychloroquine is antitocolytics, contraindicated in COVID pregnancy as it causes QT prolongation and optic neuritis and other causes. And discharge of like mother in vaginal delivery after 1 day, in C-section after 2 days. Then they may ask you like which patients are at higher risk for COVID. So firstly you have to answer cardiovascular disease patients, then diabetes mellitus, then patients with severe respiratory disease, then hypertension, then cancer patients. Then they may ask you like describe cardinal movements in second stage of labor. So I learned it like EDF ICE. So E for engagement, D descent, F flexion, then internal rotation, crowning, extension, restitution, external rotation, and expulsion of fetus. Then differentiate true pain and false pain in labor. So what they want to hear is about relieved by medication or not relieved by medication. So don't get confused here. Like true pain is regular and rhythmic, false pain is irregular. Just answer them. True pain not relieved by medication, but false pain relieved by analgesics. Okay. Then they may ask you a case study like a single liner or something like that. Just general. A patient came to you with epigastric pain, and what will you prescribe? How you deal with that? Then you have to answer. I will give him IV pantoprazole. Then I will send him for ECG. If there will be any changes, I will refer to cardiologist. If normal, then I will give neutralizing agent like gel syrup or something else. Then important question is describe sudden urine retention. They mainly ask like what are the clinical features or what are the causes. Okay, so sudden urine retention is like when patient is like unable to urinate. So clinical features like urgent need to urinate, swelling, pain, and causes like